For many Americans, Thanksgiving felt almost normal this year. But a year after the deadly surge of COVID's Omicron variant, we're not out from under the virus just yet. The CDC says a new COVID variant of concern, XBB, has surfaced in the U.S. And on the other side of the world, China is reporting a fourth daily record of new COVID infections as an unprecedented wave of protests ripples across the country. Demonstrators from Shanghai to Beijing are taking to the streets in anger over China's zero COVID policies that have kept much of the country under pandemic quarantine for years. Those restrictions are weighing on the global economy and threaten to snarl supply chains ahead of the holidays. But we begin this morning in the U.S. with the danger posed by 3 respiratory viruses. We spoke with President Biden's chief medical advisor earlier and asked him about the risks for people congregating this season.
The risk depends on what your status of vaccination is. We have 2 of the 3 of the trifecta that you're talking about. We have vaccinations for clearly COVID, particularly with the updated boosters that are now available. We have vaccinations for influenza. We're already starting to see an early surge of both flu and RSV. We don't have a vaccine for RSV. This is particularly problematic for children 5 years of age and younger and for the elderly. But there are things you can do with RSV, is avoid congregate settings, and particularly if you have a cold or if you're sneezing, and stay home, wear a mask, wash your hands.
You said last time, test going in and test coming out.
Test yourself before you congregate with people, particularly when you're having someone over for dinner, 5, 10, 15, 20 people. It's easy to do.
I want to ask you about RSV, though, specifically with little kids. These infections are overwhelming pediatric hospital wards around the country. The Children's Hospital Association and the American Academy of Pediatrics say it's a public health emergency. Is it an emergency?
Yeah. In some regions of the country, we're seeing that the hospital system for pediatrics are at the point of almost being overwhelmed. When you have like almost all the intensive care beds that are occupied, it's bad for the children who have RSV and need intensive care, but it also occupies all the beds, and children who have a number of other diseases that require intensive care or ICU, they don't have the bed for it. Hopefully, we're going to see that peak come down, because if you look at other countries that have had those kinds of peaks with flu and RSV, it's peaked early but come down.
More than 100,000 parents last month had to stay home from work to care for kids, according to the Bureau of Labor Statistics. And we've seen schools in Ohio, Kentucky, Tennessee cancel classes because of these large numbers. So coming out of the holidays, should parents expect schools to shut down?
I don't know, Margaret. I'm not sure. When you talk about shutting down schools, there's always the collateral
That's also
effects.
Radioactive.
It is, exactly. There's always the collateral issue. So you have to balance, and you do it in real time, depending upon the viral load of disease in your region.
Well, some of these places just didn't even have teachers.
Exactly. Well, that's the local decision you're going to have to make. It's a local issue. That's the thing that gets lost in the discussion.
So how do people, knowing everything you just laid out, how do they calculate their risk and protect themselves? I mean, for an older person, is it something they need to think twice about when it comes to sitting across from their grandchild at Christmas?
Yeah, I mean, it is a judgment call. And one of the things you have to be careful of is that look around not only for your own protection, but for the protection of the people that you're going to be in contact with, particularly, as you mentioned quite correctly, the elderly, those with underlying conditions. But there's also something that is even more risky. People who are profoundly immune compromised, people who are on cancer chemotherapy, people who have a variety of other diseases. You got to use common sense. I mean, the idea of coming into a crowded place and you're going home to someone who's immune compromised, it just makes sense to put a mask on.
You recently had COVID.
I did.
I wonder how that changes when you calculate your risk these days, and how long do you think immunity actually lasts?
Well, we know how much antibody immunity lasts because you can measure antibodies. They go up and they come down pretty quickly. It is entirely likely that although you may get infected with mild symptoms, the degree of protection against severe disease may be much more prolonged than the very transient degree of protection against infection. Let me give you an example. You measured me. I'm an elderly person, so my immune system isn't as robust as it was 30, 40 years ago. I was vaccinated, doubly boosted, and I got infected. Now, the antibodies that were circulating in my body were not enough to protect me from getting infected. But it is very likely that the vaccination and double boosting that I had protected me from getting a severe outcome that if I didn't have that, I very well might have gotten very seriously ill, and I had a very mild infection. I want people to understand is that although you may get infected with these new variants that are related to the Omicron, you may not be protected against infection. You're doing a pretty good job of protecting you against severe disease.
You're making a case for vaccination.
I'm totally making a case.
But I'm asking, because people think, oh, I got a 3-month free pass. I just had COVID.
Yeah.
But they can still get new variants. They can still get sick.
Yes.
In that window of time.
Exactly. Exactly. So you really want to keep up on your boosters because the protection clearly wanes. It wanes much more for infection than it does for severe disease, but it does wane.
So what is the prevalent strain that you think we are going to be facing this winter, and does the recent booster shot, the bivalent, protect against it?
Okay. The ones that are on our minds right now that you do remember is the BQ1 and the BQ1.1. The reason you keep an eye on those is that they have what's called a transmission advantage, in that they are evasive of the protection that you have. Those viruses evade the protection of the monoclonal antibodies, Evusheld, and some of the other monoclonal antibodies that are used for treatment as well as prevention. It also diminishes the protection that is induced by vaccination and by prior infection. It doesn't disappear, but it brings it down a few fold.
So are you envisioning that in the spring we're going to have to get a new sort of cocktail of booster shots to match this new threat?
I don't know, because it really depends on what is going to happen in the spring. If we get, and this is what I'm hoping for, I'm a cautious optimist, is by the time we get to the spring, the level of immunity that's induced by infection, with or without vaccination, with or without boosters, among the entire population is such that the level of severe disease and infection is going to go way, way down. And you won't require having every 4 months or so giving somebody a boost. You heard us, we in the public health arena, talk about the likelihood of getting a cadence of maybe once a year that you get it with the flu shot. Just like the flu shot. But it's a little bit iffy about that. That's good because there's a neatness to that. You know, once a year you get it in the fall, but that doesn't take into account that you have to keep up the possibility that we will get a variant that's very different than the variants we have right now that might require a springtime or some summertime boost. If it stays the way it is now, I hope it just gets down to that very low level.
And we'll have more of our conversation with Dr. Fauci ahead in the program. We're back for more with Dr. Anthony Fauci. So the White House just asked Congress for another $10 billion in funding.
Yes.
We're technically still in the middle of a pandemic, even though the president said pandemic's over.
We really do need that money for any of a number of reasons, one of which is a practical thing of outreach and PSA campaigns to get people to be vaccinated. We have a long way to go to optimize our protection against COVID, which is really a shame, somewhat paradoxical that a rich country with all the vaccines that we need, and we're utilizing them at a much lower level than we should be.
I know you're planning to retire, and I asked you when you would feel comfortable retiring. And you said not until COVID's in the rear view mirror. You said when COVID doesn't dominate the mental framework of our society. What you're saying is we're choosing not to let it dominate our mental framework.
Well, exactly.
But it is still very much a risk.
It's still there. I mean, there's a difference, and that's an important point that I want to make. If you look at where we were a year ago at this time when Omicron started to surge, we were having 800 to 900,000 infections and 3,000 to 4,000 deaths. I don't like reading in the newspapers or getting my report from the COVID team. Today we lost 400 people. Today we lost 350 people. So it's much, much better than it was, but it is not at a level low enough where we should feel we're done with it completely, because we're not.
There have been all these House Republican calls for investigations into the origins of COVID and saying they're going to bring you up to Capitol Hill. Do you think that wanes as you step down?
Well, I don't think it's going to wane for me. The Republican House has said that they're going to, and that's fine with me.
You'll appear.
Oh, of course. I mean, I'm very much in favor of legitimate oversight. Absolutely. I mean, I've testified before Congress, given the 38 years that I've been director, literally hundreds of times in many oversight hearings.
It's never been this personal for you, though. And I know when I talked to you a year ago, you were angry. You said, I'm just going to do my job and I'm going to be saving lives, and they're going to be lying.
They've clearly politicized it. I'm not political at all, period. I've never been, and anybody who knows anything about me knows that that's the case. But it is very clear when people are running their campaigns with an anti-Fauci element to it. I mean, that's ridiculous. I mean, this is a public health issue. I'd be more than happy to explain publicly or otherwise everything that we've done, and I could defend and explain everything that we've done from a public health standpoint.
President Biden said the United States is asking China for more data about the origins. Have you seen anything that Beijing has produced?
No. You know, one of the problems is that, and this is historic, it goes way back to bird flu, the H5N1, the H7N9, the original SARS-CoV-1, that the Chinese, not necessarily the scientists that we know and we have dealt with and collaborated with productively for decades, but the whole establishment, political and other establishment in China, even when there's nothing at all to hide, they act secretive, which absolutely triggers an appropriate suspicion of, like, what the heck is going on over there? So right now, what we would really like to know is all of the details of what went on with the original people who were infected. We keep a completely open mind as to what the origin is. Having said that, if you look at the examination by highly qualified international scientists with no political agendas, they've published in peer-reviewed journals that the evidence is quite strong that this is a natural occurrence. Does that mean we've ruled out that there was something funny going on at leak? Absolutely. And I and all of my colleagues keep an absolutely open mind. We've got to investigate every possibility because this is too important not to do that.
Have you seen anything that Beijing has produced at all in terms of explanation or data?
Well, their explanation is an explanation that they will not allow us to look at the primary information. The WHO went in and saw some of the data, some of which was actually quite helpful. But you know what we need, Margaret? We need a transparency and a collaboration to open things up so that we could discuss it in a non-accusatory way. What happens is that if you look at the anti-China approach that clearly the Trump administration had right from the very beginning, and the accusatory nature, the Chinese are going to flinch back and say, no, I'm sorry, we're not going to talk to you about it, which is not correct.
But they're not talking to the Biden administration about it either.
Exactly. I think that horse is out of the barn, and they're very suspicious of anybody trying to accuse them.
One of the other things that's interesting to us when we watch how the world deals with COVID is the zero COVID policy in China, where they shut down almost fully cities and things. And that impacts the global economy. It's why we're still dealing with this in many ways. Why hasn't Beijing been able to get a really effective vaccine? Why do they still struggle with this like that?
Well, it's the combination of not having an effective vaccine that they themselves made. It just is not nearly at the level of many of the other vaccines. It's just not, and that's unfortunate. And not wanting to bring in vaccines from the very beginning that were highly effective, 94, 95% effective.
Moderna or
the
Pfizer.
Moderna, the Pfizer, as well as locking down almost without a purpose. When you put restrictions, you do it to give you time to be able to do something productive so you can unloosen or loosen up the restrictions. They, at least from what we were seeing, were just rigidly closing things down, which unless you have a really, really good purpose of preparing yourself for opening, it doesn't seem to make a lot of sense.
What do you plan to do after you leave NIH in December? What's next for you?
You know, I don't know, Margaret, and the reason I don't know is I want to strictly stick to the ethical guidelines of not negotiating what my next position, wherever that may be, in a university or in a foundation or in a whatever, until I actually step down. I want to continue to write and to lecture and utilize what I will have outside of a government position. What do I have? I have 54 years of experience as a scientist at the NIH. I have 38 years of experience leading the largest and most important infectious disease research institution in the world, and I've had the privilege of advising 7 presidents. I could use that experience, that know-how, that judgment to help others, to write about it, to lecture about it, and perhaps to encourage, at a time of anti-science, the best and the brightest among the young to at least consider a career in science, in public health, and importantly, in public service. If I can do that after I step down, I think that'll be, something that I would be pleased with.
We'll be watching. Dr. Fauci, thank you for your time today.